Hi, everybody. Welcome back, friends, to another episode of ASAP Pathway. I am your host today, Dr. Stacy Ochoa, and I'm fangirling this morning because I have two people on here that I just completely admire, and I can't wait to dive into this conversation and just really go over the things they're doing that are just so amazing in their communities and raising awareness on what they're doing. So I just want to dive in, introduce them, and let's start having some conversations. So today we have Dr. Liz Turner. I don't know if you go by Liz or Elizabeth. Do you prefer Liz?
I go by Liz. I used to go by Elizabeth, and then
Okay.
I lost my elegant name for my social name.
Okay. So Dr. Liz Turner and Dr. Meggie Graham. So let me just tell you guys a little bit about them. There's a lot to say about them, but I'm going to try to just summarize it just so we can dive in. Dr. Turner is a Tufts dental graduate and was practicing as a general dentist for many years before discovering the link between oral restrictions, growth and development, and basically everything else in dentistry. After her son was born with a tongue tie, the light bulb went off and she never looked back, completing nearly 1,000 hours of continuing education in the last 5 years with an emphasis on functional occlusion, breathing, growth, and oral restrictions. Never in her training did anyone talk about the tongue and the profound impact it has on the body, and her mission has been to help find the root cause in each individual patient's health journey. She is a proud mom of two babies, age 6 and 4, and maintains a functional general dentistry practice as well as an airway tongue tie health center in Denver, Colorado. And of course, I'm going to get links that I'm going to put for you guys listening that want to contact, want to reach out to them. But I also want to talk about Dr. Maggie Graham.
Well, Stacy, you
Oh,
could
yeah.
save time and just say ditto. Other than I could swap out.
Okay,
Like if you have
ditto.
Mad Libs, you could just swap out like the school and the gender of the kids, and everything else is the same.
Everything else is the same, but she went to Marquette University School of Dentistry, and and then your practice is called. You have two practices, so you also have a functional dental practice focusing on getting to the root cause as well, and restoring people to health. But also, you have Untethered. So, and then you guys kind of you practice in two different areas. So you're in Colorado, you're in Milwaukee, right?
Correct.
So at first I thought, wait a minute, are you guys, traveling and doing this together, doing the kind of this untethered journey together and in the same location? And you're like, no, we actually are growing our practices, obviously working together, but we plan on even growing Untethered nationwide. So like, tell me what, Liz, I'll start with you. What happened that you said, oh my gosh, this tongue is what happened? What happened that you said, what the heck? The power of the tongue, the influence of the tongue. Never have I been taught this. And you literally developed an entire separate practice on this whole topic and helping people. What happened?
Goodness. I mean, Maggie and I, we could just ditto ourselves all day. So my journey started with oral restrictions for my son 5 weeks after he had treatment, or he had treatment at 5 weeks old. And then 3 days later, my father-in-law had a heart attack due to AFib and years of undiagnosed sleep apnea. And his maxilla it's not causative of the sleep apnea, but it's a major contributor to the sleep apnea that was missed from when he was a child. So speech impediment when he was 4 years old, bilateral posterior crossbite, he's got oral restrictions, he's got all of the things. And then I start looking at all of the lifespan. So I've got my father-in-law, I've got my boy, I look at my husband and I go, goodness, they've been trying to put you on trazodone for years. Why don't we test you for sleep apnea? He's got sleep apnea. So I started to put the pieces together. And so I went the other way. Maggie went airway first and then into oral restrictions, right? And then I went tongue tie oral restrictions into airway, because you think you're going to do one thing, but then you realize everything's connected. And then it's TMD, it's occlusion, it's dental failures, it's why did crowns break down? There's so many layers to all of this. So when I bought my general practice 3.5 years ago, I started an airway tongue tie center out of it, as did Maggie at Lake Park Dental. And then we realized we had met organically through a mutual friend who is very special to both of us, and also through the power of social media and connection and meeting people and conversation. And we realized we were growing our practices parallel, and we were doing it alone. So what was the point when we could do it together and be better together and work to build a network of providers within our own practices and potentially more in the future that could help so many families? There's no reason people should be traveling from Alaska or Wyoming or Montana or Texas to my practice when there could be providers in other areas that have similar training, philosophies, and protocols to help kiddos and families thrive.
So when people hear this, so the audience is vast. Like we've got, dental healthcare providers. We have medical health providers. We have moms and dads, and I, as I learned last week, dental students that are listening. So yay! I know, I'm so excited. But it's when you mention I started here and then I went into airway. Meggie, you started with airway, went into oral restrictions and helping with those. But and everybody that I talk to on these podcasts, I mean, we all can say this. It's like drinking from a fire hose, because it's like there's so much information. And what I want when people hear this, I don't want them to feel like, oh, it's so much, I could never do this. Mm-hmm. You have to start somewhere, right? You just pick something that's passionate for you and start somewhere. You don't have to do it all, but find a niche that works for you. And then you can start growing that, and then find your community and refer the other stuff you know want to do. So, I mean, I have the most impressive, like, I'm so impressed with you. I'm so impressed with Meggie and the level of knowledge that you guys have and the grit it takes to get the education to learn this. I mean, this is not taught in school, guys. We didn't learn this.
Maggie, what were we described as? A freight train that won't slow down?
Yeah, exactly. We're riding momentum that we have no control over. But I think that's the part that is a shared passion between Liz and I. I want to just piggyback on what Liz said about our decision to kind of join forces and partner up and have an Untethered Denver and have an Untethered Milwaukee, and then hopefully future ones, is that we both want to create awareness, and we both want to help spread the importance of early intervention and functional impact on the growth of the mid-phase. And we decided that together we have a bigger footprint. Together we can reach a bigger audience. Together we can get in front of more patients that need help. And also, I think that we could attest to how difficult that was to build a separate practice from our general dental practice. And if we can help providers in their journey of becoming airway aware, I'm stealing that from our mentor, Jeff Rouse. Yes. Airway aware is good enough. I think a lot of people are hesitant to dive into quote unquote airway because they don't want to change the flow of their practice. They don't want to change the scope of their treatment. And that's okay. In fact, it's probably favorable. I mean, I almost lost my general dental practice based on my attention to this other practice. And that's where I think we also have power to help. Okay, guys, we already have the systems and the setup to do this. You want to do the treatment, let's help you get there, right?
Right.
Just trying to create an easier, less resisted path to helping more people.
And that is exactly, again, I always say this, a rising tide raises all ships, because that is what our mission with ASAP Pathway has been, is if we can get more people a easier path to gain the knowledge, to gain the foundation. Like you said, airway aware is enough. You don't have to do everything. Just have an awareness and just start screening and start referring and building your team and collaborating. But then you might want to start working on the littles. You might want to start just doing, restriction releases. You might want to do only adults and MARPI and things like that, and skeletal expansion. Find your niche. Everybody's different. There is no there's no cookie cutter for what the right way is for you in your practice, but like the experience, this is why we started ASAP Pathway, was we had our difficulties in our practices navigating this. And it's like, man, I wish someone would have told us this. I wish somebody would have told us that. I wish somebody would have said, start here, don't listen to this. And that's what you're doing. You're trying to, hey, listen, don't do what I did. Do it this way,
Yeah.
And I think there's so much value to that, of what not
Stacy,
to do.
There's so much parallel with ASAP too, right? Like you guys created this. Liz and I, we were nitty gritty in getting our education, right, Liz? Like we've traveled, we've thought it out. We have done thousands of CE hours across the globe. And what ASAP has done for my career is centralized that learning, right? It's given a platform and a place to go to further my learning, because you are bringing the education to one spot. You're finding it for us, and you're bringing us the education that we need to continue growing and learning. So thank you.
Well, thank you. We very much appreciate that, and admire you and Liz for what you're doing as well. It's, like, I think what's wonderful about our community and how it's going to explode. I really believe it is exploding. It's going to explode. I think the next 5 years of the collaboration between medicine and dentistry is going to look very different. But what I love about our community is it truly is a place to lift each other up. It is truly a place we all are very aligned for the most part in raising awareness, raising up more practitioners to feel comfortable to insert themselves into this much needed facet in healthcare. Nobody can do what dentists do. The medical community needs us. The public needs us. So I very much appreciate that. And Meggie is, when she says, oh yeah, we're nitty gritty with our CE, I cannot tell you how many times I popped on Facebook and one of the first images is like, Maggie's at a course nursing, and it's like, she's nursing, she's at a course. I'm like, this woman doesn't stop. It's like, you guys have so much grit.
You can't. And I mean, we're all, as dentists, we're swimming upstream in the medical community. So like, why not do it together? Because it just makes us stronger. It makes our impact stronger. It makes our voice stronger. And that's what we need. It's unfortunate how disconnected so many medical providers are, and even the general population, that the oral cavity is so important. And breathing, it starts with the oral cavity. So I don't know why we're being dismissed, we're being ignored. And I think you're right. You said this before we started. It's happening. It's finally happening. People are finding us organically. This generation is not afraid to ask questions. They're not afraid to get a second opinion. They don't take everything that's told them as fact. They do their own research. And I think it's almost hard for me when people come in and they're like, what should I do? I'm like, well, like, you should do some research so that you feel supported in the decision you make. I'm not going to tell you what to do. I'm going to be an information giver to you to help guide you in the decisions that you make for yourself and your family. But I can't tell you what to do. I want to be a voice. And I think that's what collectively we can start to be for people. We are, and it just seems like for so long we're all individuals, and now we're a mass and it's bigger.
My favorite thing to do right now is, yes, we offer a lot of treatment modalities that can help change structure, function, behavior. Those are the three things that we really work on. Of course, we have those services. That's our business, right? But I love the role. Even if they don't want my services or need my services, or they have somebody else, I love being the quarterback or the air traffic controller that has this 30,000 foot view of, okay, here's the whole thing. These are the different pieces to your individual puzzle. I had a really interesting presentation by an ENT last night who has done a lot for creating awareness of the importance of nasal breathing. But there's a disconnect between that anatomy that's shared between the roof of the mouth and the floor of the nose. Yes. One of the things he said was, come on, everybody has a deviated septum, and not my presentation, so I don't have the floor to say something, but you think about it, why do we have a deviated septum? We have a narrow palate. Like, that's shared anatomy, and we have influence over how that palate and floor of the nose is shaped. So I think that that awareness of what we can do is a really big driving force, like helping them understand that, yes, we are dentists, but we control one of the most important parts of the body, right? The midface, or what does Kevin Boyd call it? The
craniofacial respiratory complex. Exactly.
Yeah,
you just took the words out of my mouth. I'm like, that is the best description I've heard of what we're actually influencing. It's a beautiful
description.
Yep.
Craniofacial respiratory complex.
Yes.
Right.
And we influence that. Dentists, orthodontists, pediatric dentists, we influence that. And
myofunctional
therapists, you know, it is, it's definitely changing. The winds of change are happening. I mean, in fairness to our medical colleagues, I mean, they're up against the same thing where they didn't learn this in medical school. They're out there. They don't know. And let's get real. I mean, the system in which most medical doctors are working right now, it is just, they have this much time. All they're working on electronic medical records. I mean, do they have enough time to have the much needed conversations? You are seeing more medical doctors going concierge and just kind of getting out of the hamster wheel of medicine the way it is right now. So I think there's just a lot of broken pieces that are having to be restructured, and it is happening. And like you said, I think the population now, for the first time, they're information hungry. They're advocates for their own health. They have no problem getting a second, a third, a fourth opinion. If you go back, even just my parents' generation, they didn't challenge their physicians or, just ask why and definitely not my grandparents. It was like, this is it. It was like a God complex. They were like, okay, my doctor said, and they never, so it's changing.
And we know, right, in the middle of it, we know that not every provider is created equally. Not every provider has an answer. Yet if they have the confidence to portray themselves as having the answer, that can do harm, right?
Yes, very much so. And I think even the culture of medical school and the culture of dental school, I mean, when I'm even talking to some physicians now, they're like, we're working on even changing that. Just instead of walking into the room and talking at the patient, it's like you're interviewing them, you're listening to them. You're a student of your patient. They're the teacher, you're the student. And it's changing the mindset when you walk into the room of, okay, I have to be present, clear out what I just went through with another patient and be an open vessel and take it in. And I do think too, which is why I think in the airway community, you're seeing a lot. I mean, there's plenty of male practitioners, but you're definitely seeing a lot of female practitioners taking this and running with it, because I think naturally, I think the female practitioner just tends to sometimes listen a little bit, not have preconceived notions. Maybe we're a little easier to talk to. I don't know, but it is definitely something that I've even had medical doctors tell me, like, it's really interesting, that in this airway community, I'm just seeing a lot of female practitioners. And I said, one recently said that to me. And I said, I also feel like this is very personal. What gets you on this journey is your own personal journey. And moms, when they're wanting to help their children or their niece and nephew, I mean, they're a force to be reckoned with. And a practitioner mom is a real force to be reckoned with.
Well, and that's what I tell patients all the time is, 100% of us that are in this space have had some form of experience in it with our families or people that we care about. And that's what I tell families when they come to us with baby consultations and treatment, because these sweet, sweet mamas and dads are so worried about bringing harm to their child. And I say, I'm not in this because I want to influence things for you negatively. I'm in it because I care about growth and development of the jaws. Like, I don't want to put your baby through something harmful, but I want you to know what the impact of this can have, because we've been through it before. We've seen it with our families. We've seen it with our patients. And so, yes, I do think a female practitioner, because we're the ones that have our concerns were dismissed. And what's the study that says how much maternal or female discomfort and female symptoms is underappreciated and just dismissed by the medical community. I mean, there's a statistic it's really scary and sad.
Well, even the literature and science in general, medication and pharmaceutical industry, just science in general, heart health, all of it was based on male participants, male numbers, right? And it's finally, they're saying, we probably should study the women too, because we're not the same. Yeah. It's like, it's such a bias toward.
My sister-in-law is on a transplant list. She has an autoimmune condition that's affecting her liver. And for so long, she hasn't been able to be on the transplant list because it's all been based on male numbers. And it's not until just this year that they were changing the numbers so they were catered towards women, because everything was skewed towards the man.
Yes, so, it's a very real thing.
It's
we know the phrase, like, once you see it, you can't unsee it. Once it's personal, you become passionate about it. Like, I think that those combinations of things make us, like Liz said earlier, a freight train. There's no stopping. There's no going back to how we used to practice, because you can't unknow it. You 100%.
And our patients that have been through it see it too. I saw a sweet woman yesterday. She came in. I said, "How did you get started? I want to know your journey. I always want to know where people came from, because what was your chief concern that led you to go through orthodontic surgery and myofunctional therapy and body work and nutritional?" And she goes, "My front tooth was a little crooked." And I go, "Oh, then you drank the Kool-Aid." She goes, "Oh yeah." And I couldn't look back. I was like, "Oh, I'm so happy to hear you say that," because it's true. Once you see it in yourself or your family, you can't unsee it.
Have you guys heard people say, like, colleagues, maybe this is not so common in our little circle now, but like so many times colleagues will like not present all the treatment options because they, like, for this patient example is like, what if that patient didn't get the resources to understand that she had access to life-changing skeletal change? Exactly. And I'm faced with colleagues that say, like, they don't want to do that. Insurance doesn't pay for it. It's too big of a deal. Whereas I think our role as providers is say, hey, here are all your options.
That's exactly right.
Choose to do something big. Office. You might not choose to do that, but that's your choice. I think we have to be the information gatherers and then the information givers, and then they get to have the autonomy to make the best decision for themselves.
I think that's excellent, because it's funny, because I've heard this. Because I started with adult dental sleep medicine and got into this. So that's my journey too. I would go to conferences, and I cannot tell you the number of medical doctors. They're very, very, very concerned about what insurance pays for their patient. They've been trained to literally present treatment based on what they think insurance will pay. It's very different from dentistry. And to me, and I've said this, I'm like, this removes the autonomy now. You haven't given the patient all of their options, and
they can't make informed consent.
They cannot make an informed consent.
And we see that in sleep all the time. Oh, I don't qualify for a CPAP. Well, did anybody talk to you about other options? Did anybody talk to you about why you have this?
Did anyone tell you you can buy a CPAP for cash? Like, they might not be able to, or they might not choose not to, but they should get the choice.
Yeah. And there is this dental device. I don't know if your insurance will cover it. It might be, some out-of-pocket cost. I mean, I've had medical doctors so nervous to discuss a patient's, financial responsibility. And I'm like, wow, you literally do not even discuss an important option in their treatment at all because you're afraid insurance won't cover it. And they're like, yeah.
Well,
I'm like, that is, to me, I'm like, that's unbelievable. You can't do that.
We know that insurance is not in the game of helping patients be healthy. We know that it is a for-profit business that is going to put up as many obstacles and barricades to patients. How can we let them dictate treatment options? Like, yes, I know that there's financial barriers and sometimes things are unattainable, of course, but that shouldn't influence how we're presenting options.
Yeah, I always say to my team, if I ever catch somebody not presenting the full spectrum of their options and doing wallet biopsies on anyone in my practice, I mean, that makes me ill. First of all, it's usually the people that you think, oh, well, they probably couldn't afford. They come in overalls and, just look like, they're a farmer or I'm like, those people walk in and pull out cash and throw it on the counter. I mean, you cannot wallet biopsy people. And how insulting. Tell them their options and let them get creative and help them get creative, help them make it happen. And like you said, sometimes it's unattainable and maybe it's just not a right now. Okay. But they know it's an option for them in future and maybe they can plan for it. And that includes, things like maybe skeletal expansion or, doing different things that maybe are considered boutique or not mainstream medical insurance coverage. So on this topic of money, okay. Liz, I'm going to come at you with this question. See if you can help us better understand. So the New York Times, those of you that might have heard or in this community, the New York Times came out with this article basically on the money-making business of,
cutting babies' tongues.
And, really just, it was huge. It was all over the place. And
a few weeks after the article came out, they did a podcast and like re-ruffled the feathers, right?
Oh my gosh, I didn't know they did a podcast.
Oh yeah.
Oh my gosh. Okay. Speak to those that are listening. Like, this is what makes me sad is like, look, I get it. Are there sometimes someone's doing a release or someone's doing expansion or someone's throwing in a device in someone's mouth, just cookie cutter. They're not looking at the function. Is it possible that's out there? Yes.
Of course.
But is that the majority? Right. And so speak to that, Liz. Like, what would you say there could be parents listening or practitioners listening that were on the verge of taking their baby in for an evaluation for a release, and they pulled back after the New York Times article?
Yep. I just think it's so unfortunate how much fear was instilled in new parents from that article. And I would encourage those who haven't read it to read it. And also to, as they read it, think about the stories that they present and the verbiage that they're using to describe not just like dentists who do tongue tie release, but dentists in general. Like, they even bring up a conference called like Tequila and Tongue Ties. And it's like dentists were taking shots and then talking about tongue ties. It's like, okay, well, like, I'm not taking a shot before I do a tongue tie release. How do you know any of these people are even taking shots? It was just an opinion piece with so much
bias,
so many challenges and bias, and the way that they painted some incredibly talented, kind practitioners is just unfortunate. I mean, 3 of the children that I treated yesterday were cut by the pediatrician and were told that they'd had their frenectomy. So they come into our office, they spend 75 minutes, and they say, well, this is different than the cutting of the tongue in the hospital. I say, yeah, because we're not. We're releasing it after assessing for function and working collaboratively with an interdisciplinary team. And I even tried to tell you that you should come back next week and think through this decision to do this release. And you're asking me for treatment. I'm not forcing you to do anything. Whereas you told us that just the treatment you had in the hospital was like, okay, we're going to go do a tongue tie release. Did anybody talk to you about risks, benefits, what's next? Meeting with a lactation provider or body worker. The lack of, I think, respect for us as not only release providers, but as a profession that came through in that article was just so disheartening. It's kind of like you have a parent who's just fearful already because they have this new baby and they barely know how to manage it, and there's no manual for it, and they're on the internet all night long, and they get blasted by this piece, and they're so fearful to even show up to have a conversation about what's going on to their lactation provider or to the dentist because they're scared we're just going to like steal their baby and cut the tongue. I don't think that's fair, because I think as parents we're entitled to information. And when you're taking only one side of the story. And we do know that other providers who are putting out the research were interviewed for that article, and none of their information was included.
None of it was included.
What in the world?
Yeah.
Because
we know firsthand, right, Liz, that like people that have been instrumental in creating and creating courses and doing the research that's so lacking.
And one of the arguments was there's no research. Well, they interviewed the people doing the research, and there's research, and there's plenty of research. It's just when pediatricians are looking at this, they're looking at a textbook from the 70s. It's also an opinion. It says, well, tongue ties aren't a thing. So it's just hard. It's hard. And I like put my head in my hands when families ask me about it, and I say, you know what, I'm just glad you're here. And they say, I am too, because we're able to talk through it.
From the money grabbing side of this, one of the things that I think is important to note is, I know the two of you can attest to this, but for those of you who are not providing these services, I assure you that doing restorative dentistry and fixing the problems that are repercussions of suboptimal function, suboptimal growth, that dental work is avoidable if we get to the root cause while these kiddos are still growing. And it's a hell of a lot more expensive.
It is.
And invasive. If I was in this game to make money, I would cut teeth only.
I have said this, look, you can have a beautiful niche, specialized, like you guys have, Untethered or Bloom, just different niche practices, and it's profitable. You have to be profitable to have a business and then provide a service. You have to. But to say that this specific industry is like money hungry and I make way more over there just fixing teeth from lack of root cause acknowledgement all day long. And you know what? Dentists are fixing, people don't listen. And all we do all day is fix what people aren't listening to us. Like, we're telling you what to do to avoid ABCD, and they just don't do it. And so we're fixing ABCD.
It's great for the dental restorative business, right?
Yes,
if people don't do this, it's great for us. But like we said earlier, you can't unsee it. So if you can't unsee it, I have a passion to help avoid unnecessary care. I think that's where medicine should be going. And that's not a popular opinion because it's not based in profit.
Right. It's actually the opposite of what is being pushed and portrayed about this industry, even among, some of the orthodontic blogs out there where there's some naysayers about interceptive orthodontics at a young age. Oh, it's because they're money hungry and I'm like, this is a passion. God. This is not, I am not rolling in the dough.
Ortho gets in the way of making money, right? Like how much time it takes. And, it's too bad. It's too bad. Sorry, Liz, I think I cut you off. What were you going to say?
No, well, even with, talking about oral restrictions, treatment's not for everyone. Like maybe there's a family that just really isn't prepared emotionally, mentally. There's some postpartum anxiety, depression. The family members, mom and dad, aren't on board with how they want to feed. Well, I mean, don't do it. But at the same time, if we look at the benefits of what it can be when you have a child who's symptomatic, whether they be in babes, littles, bigs, symptoms are symptoms and they shouldn't be dismissed and they should be talked about. And you should be given your options, just like you guys are saying, where we need to be offered everything that's available to us. So families shouldn't be scared out of getting an opinion on something that could be potentially challenging, because all medical procedures are challenging and all of them take some type of rehabilitation or prehabilitation. You don't go have cardiac surgery and not do cardiac rehab. You don't go have a knee surgery and not do physical therapy. Like this stuff, it does take time. The oral cavity is no different than the rest of the body.
Right.
So even when in the article where they're talking about how challenging the exercises are, they're hard. The active wound care, they're hard and they're not for everyone. And that's okay. Then you don't need to elect to have this treatment done. But to scare everybody else from coming to have something that's beneficial away is just unfair.
It is unfair. And I don't think it's even ethical. I mean, I think that, as we are to do no harm. And we also, I cannot do supervised neglect. Like, can't do it. Once you see it, you can't unsee it. I was going to put out there, how people can find you guys. You have a website, Untethered Airway Health Center.com. Is that correct? Untethered Airway Health Center.com. I'll put this all in the link as well when we launch the podcast. Also, you guys have an Instagram page, Untethered Airway, at Untethered Airway on Instagram. So people can find you, and I would assume
like you guys
too,
have done, Stacy, like you guys have done such an amazing job of creating resources and awareness for parents. I can't tell you how many times a day I'm sending a link through our software system to ASAP, right? We want to do the same. We want to do it. We want to offer more resources that are based in truth. So we've spent a lot of time trying to create an Instagram account and a website that is a good resource for practitioners, but families.
I think love it.
It's a work in progress. I mean, we got to think about what we are trying to accomplish. We're merging businesses, and we have been for a long time. Now we're doing it in name, not just in, I guess, philosophies. But we're moms, we're double business owners, we're human beings. So we are doing our best to bring these resources to the masses. But I hope you'll follow along in our journey.
Well, absolutely. We support you guys. I mean, again, we're fans of you guys as well and what you're doing, because really what ASAP is about is exactly what you're doing. It's raising up practitioners to help more people, that ripple effect. Let's educate more practitioners. Let's get more practitioners understanding this, becoming leaders in their community like you guys. And the fact that you're starting to do this and tear down the obstacles of what makes it so hard to get started, like, that's what's beautiful. Let's remove what doesn't work. We've paved the way. We know what works. Just join the movement.
Yeah. If you're listening out there and you like what we're saying and you're in a spot where you think an Untethered should be, let us know. We want to connect with as many people as we can. We want to grow this like you guys do at ASAP as far as we can, because we just believe that there's so many people that need help and not enough resources.
Well, I love it.
We're both still restorative dentists. You can still be airway aware as a restorative dentist. You can still actively treat as a restorative dentist. So not knocking restorative dentistry. I actually love it.
I do too. I still love restorative dentistry.
Yeah. And
I love
people
it.
say, they're like, are you only going to do this? Like, you should only do I'm like, I don't actually want to only do this. I really like what I do with teeth now. I didn't before. It's so much more fun when you look at the whole picture.
It does. When you pull back and you look at the person as a whole. And actually, I did a podcast. Actually, I believe it's launching today with Dr. Susan Maples. And she said, oh my gosh, Susan Maples. I love her. I just, watching her speak and work a room, I'm like, woman, you're my hero.
Along with your website link, I also hand out her book.
Oh my gosh. Yeah. The Brave Parent. Is that the one? Yes. The Brave Parent. She's amazing. And we talked about the topic of why the mouth got removed in medicine. Like, they took the mouth and they gave it to the dentists. Okay. And it's like, we need to bring it back in. Maybe we need to have residents and, from medicine, visit with dentists and work on that collaboration. So they're coming out of med school already understanding the importance of that collaboration. And I just think the future's bright because of people like you guys. I'll put the links for how people can reach you in inside the podcast as well. But I always like to end with just like a little get to know you. So I'm going to ask each of you a few questions if you're okay with that. I know you guys got to get to patients. Liz, I'll start with you. What is your favorite thing to do on a day off?
Oh goodness. I love running. It's like it's my space. It's my thing. And it'll always be there for me. So to be able to go out and do that on a free day, and then to come home to my babies, because I just feel like I don't spend as a working mother, I don't give them the time that they deserve. That's like my best thing. And then a glass of wine. So
yeah, that sounds so great. That sounds great.
Those three.
Maggie, what about you? Your day off. What's your ideal day off?
My ideal day off, and I have to work on protecting those days off. It's so easy to fill those days with shoulds and meetings, and I need to start to block those
Same.
precious
We were just
moments.
talking about that yesterday.
I have the privilege of living on right by blocks from Lake Michigan, and it is such a gem and a gift. And my favorite place to be is on a rocky beach, looking at Lake Michigan with my kids, throwing rocks. Sometimes cold plunging, sometimes sitting there, sometimes walking. That's my happy place.
I've seen some posts of you in that happy place. I'm like, oh my gosh, that looks heavenly. You're very intentional.
I can't believe I live here.
Yes, I've seen I love following you. You're very intentional with your life, Maggie. You're very intentional with your life. I admire that. All right, guys. Favorite dessert, Maggie, and then I'll go back to Liz on it.
A really good key lime pie.
And it's hard to find a good one
when it comes to good key lime pie. But if it's a good one, there's nothing that tickles my fancy more than that.
Yeah, it's hard to find a good one. It really is. And when you find it, it's like the perfect blend of refreshing and sweet and creamy, and that's so good. What's your favorite dessert, Liz?
Oh my goodness. I mean, most of the desserts that we get come from the office, so nothing bundt cakes. I mean, they're so addicting. And the white chocolate raspberry one, the best.
Oh my gosh. Actually I had one yesterday, and I had
someone brought it to you.
Yeah, someone brought it to our office, and I got the strawberry. It's like strawberry something with like the creamy icing on top. They're going in across from my office. I'm like, yay, we're getting a nothing but cake. I know. It's
Liz,
gonna be dangerous.
What about taffy helium balloons? We just had an experience in Chicago where a group of our dearest friends on the same journey as us had the most remarkable dinner, a course meal of sensation and texture, and it was an experience. And at the end, at the dessert, they came out with helium balloons for each one of us, but the helium balloon was made out of taffy, green taffy. Ooh. That was stretched so thin. And so as we ate it and we're inhaling this helium, we're all sticky and laughing hysterically and talking in helium voices. It was
that's amazing.
I think about that's my new favorite on video. Dessert. Yeah,
that's my new favorite dessert.
I even Googled, is helium dangerous?
Yes, I've heard that.
If I post this, am I going to get blasted for
like, do you know how bad helium is for you? Look, if it is, I'm in trouble.
High school anymore. This is a regular thing.
I loved after a birthday party. Matter of fact, my son's having his 16th birthday party. We're doing that Saturday. Aww. And I am going to partake in a little post helium. I always do, just to, in the birthday party.
Yes. Than a high
just a teeny little bit.
A little bit. It's just to sound goofy. I love it. Yeah, I don't need any hate mail on helium either. Okay, last question. Liz, what was your favorite show as a kid? One of your favorite shows?
I was a book reader.
Good for you.
I book a day. And I mean, I was in my head. I was very shy. I didn't say a word.
Okay, what was your favorite author?
Until I was like 12 years old. I loved the Babysitters Club. I loved it.
Babysitters Club.
And the Type A was coming out then, because my parents were like, if you read 100 books, you can get your ears pierced. And I was like, okay. 60 days later, they're like, did you read them all? It's like, I did. So
I did. Yeah, and the Type A was born.
but Forrest Gump, I mean, best movie of the whole world.
Such an amazing movie. Yeah, I can't watch that without bawling my eyes out either. What about you, Meggie?
When I was little was Double Dare with Matt Summers.
Double Dare, yes.
I don't remember which network it's on now, but we've actually bought a couple seasons and we're watching it with our kids, and like it's so nostalgic. And they're like not that into it, but my husband and I are just like, oh yeah, remember that? It's still so good.
It is.
So this is like the tiniest tangent, but have you guys seen the show What Would You Do? I think it's called. And they come out, they put unsuspecting bystanders in a really hard situation. Like somebody's coming out and they're racially profiling somebody's hair during a job interview. And they wait to see if the person's going to speak up. And most of them do. Maybe they don't show everybody, but that's how I feel like about airway stuff. I'm like, am I going to speak up? Am I going to speak up? Yeah. So that's a
I'll
good
check
one
it out.
right now. Yeah.
Yeah, I'll have to look at that. But again, that's a good way to end this is you're like, do I speak up? And the answer is yes. And we all speak up and we all do this together and we help more people because that's why we went into this.
I have a quote on my wall in my office. It's big. It's like the centerpiece. It's the
beautiful.
It's the artwork in there. And it's a Maya Angelou quote that says, do the best you can until you know better and then do better. And I think that really encompasses what we're doing. It's like, we're just continuing to get better and better and hopefully bringing people along with us.
I love it. You guys are doing great things and your ripple effect is, you have a great legacy and appreciate you guys. Well, thank you so much, guys. And, everybody check them out. All the links in the podcast. And thanks for being here, everybody. Everybody, thanks for joining us today.
Bye.
Bye.
Bye.